to Healthcare Talk Show this week. This week we're going to present you about cardiovascular disease and cancer. Today is very interesting topics. And here, our very honored guest, Dr. Gauri Vichayapai, is coming to us in this room to help us explain the cardiovascular disease and cancer for you guys. Please welcome him. Nice to meet you, Dr. Gauri.
Hi, Norfolk.
How are you today?
Okay, sure. What is the topic today?
Topic today is cardiovascular disease and cancer.
Okay, nice.
So, doctor, where did you come from?
We come from Rama Hospital, I think the best hospital in Thailand. And maybe sometimes I go to America for some surgery that need.
Good. Yeah, a famous Thailand people working in America.
Of course, everyone in EIS, the popular school of like medication know me. Everyone know me because I'm the best of that. I get the GPA of 4.0.
So, doctor, how many types of cardiovascular disease there are?
There are 6 types.
What?
Main types of it. There are hypertension, arteriosclerosis, heart attack, arrhythmia,
Okay.
aggressive heart failure, and stroke.
Okay. So, doctor, what is the first one of the cardiovascular disease?
It's hypertension.
Can you explain hypertension?
Hypertension is high blood pressure is about 140 over 90. That is so much or more.
So, why people call it the silent killer?
Cause hypertension frequently or unexpected or undetected. So sometimes people die simultaneously.
So, how do we know that we have hypertension?
So what you need to know is to measure blood pressure. If it's high, then hypertension.
So, hypertension can lead us to heart disease.
Yeah. Of course, because hypertension can lead us to heart disease. Because the high blood pressure can make the strain on the heart and blood vessel.
So, doctor, what is the second disease?
Arteriosclerosis.
So, can you explain about it again, like this time?
Okay, sure. Arteriosclerosis is like a plaque blocking the blood vessel so the blood cannot go easily, that make the blood pressure increase.
So, what is the plaque?
Like fatty substance that can be breakdown, include cholesterol.
So, what does arteriosclerosis mean?
It can make more chance to be more like have a disease that the same disease, the cardiovascular disease. It has chance to be other cardiovascular disease easily. Okay. Okay. Even when something blocks the arteries way, this is called the coronary heart disease. Coronary heart disease is when the arteries that is narrow, when it's narrow, the blood goes to the blood goes to the heart more less. That may have a pain in the chest. The pain is called angina pectoris.
So, what is the angina pectoris?
It's when you feel pain on the chest.
Oh. So, Dr. Gauri, what is the third one?
Heart attack.
Oh, heart attack. It got me very sad because my grandmother, she had heart attack and died.
Really?
Yeah.
So sad for you.
Yeah.
So, you want to know why your grandmother died and how heart attack work?
Yeah, tell me. And also tell the audiences. And please, audience, beware of heart attack. It can occur to your age, every age.
So heart attack is like when your tissue in the heart don't get enough blood and not get enough blood that have high oxygen. So it gets less oxygen and it just die. The tissue just die there.
So, doctor, do you know how many people have died in a year?
About 500,000 people cause of heart attack.
So, you know the warning of the heart attack?
Yeah, sure. About 3. It's have like a uncomfortable pressure or pain in the center of the chest lasting for 2 minutes. Like some pain. And pain spread to the shoulder, neck or arm. Spread from here to here. You might need grandmother happen that way.
Yeah.
Why?
Good doctor.
And the third one is severe pain, nursing, fatigue, sweating, extremely acid, or shortness of breath.
Yeah. So sad, my grandmother.
Yeah, because it's very dangerous. If you go to the medical, they can just tell you your life or death if you come out on time. If you come out on time, you may have to die. When you come out on time, you're dead. So take care of your grandmother if you want again.
Thank you, doctor. So, let's go into the subject again. So, what is the 4 major risks for heart attack?
It's like a high cholesterol of the blood, high blood pressure, have a physical inactivity, and smoking. You know that some kids that smoking can make heart attack, even a cancer.
Doctor, so what is the 4th one?
Arrhythmia.
So, can you explain about it?
Arrhythmia is abnormal heart beat. Some is faster, some is slower, and the twice the heart beat rapidly is called fibrillation. Some is can control the medicines, and some you use the surgery.
So, doctor, so what next? The
Big one?
Yeah, the big one.
Congressive heart failure. Congressive heart failure is like a heart is weakened over time, you know. When it's weakened, it's kind of blood like usual. It's not blood like lesser than it's good. The blood cannot get enough, or the heart cannot get enough blood, something like that. And the way to treat, you know it?
Yeah.
The way to treat is like there are some kind of drug that you see like we sell like a make a mass way. So this can help.
So, doctor, we come to the last one of the cardiovascular disease.
Finally,
The stroke. So what is stroke?
stroke is like it's like a heart when heart is getting not enough blood because of some fat block. This similar because this is blocking to the brain, not the heart. So this may happen when the plaque blocking the blood vessel to the heart, and some may happen when the stroke can occur when the brain bursts, like the blood bursts to the brain and blood in the cerebrum. The cerebrum is about this part of your brain.
Yeah. So, what does stroke affect our body?
So the least one is like your sense, your memories. You may have memory loss. Like you cannot move your hand. Like you cannot move your hand or your control. And some you may cause one side paralyzed or paralyzed in your body. And the last one is you may die.
That's serious problem.
Yes.
So, doctor, how can we prevent cardiovascular disease?
Yes. It's have like a risk. Do you know the risk? It's some risk we cannot control.
We can't control some risk.
And some risk can control when you control the cannot control for because you just come fast. So you feel better and know a lot. So the thing that cannot control is like immunity from your father and mother from the gene. God is cannot control. You cannot take some trait from the gene of or the chromosome of. You don't know when you have sex, like something like and they have the children, or you don't know, so you cannot prevent in the community. But because of the real race, like Negro, you know Negro, the black guy. You know in my year 8, the meditation phase, we have Boogie the Negro man. So only Negro in my class. He is very black. And you know black skin are more resistant to through the sunlight. Yeah, that is not about cardiovascular, but it's just an example. So this have like gender, male and male. No, of course, male and female. Male and female, okay, man.
Okay.
So male and female. This some have a different chance. Like a female have more chance to get stroke than male. And some, but not your third gender. I don't know what third gender is not like gay stuff. And it's have like age per age. If you are like just born 1 years old, you cannot be like heart disease and horrible in the heart and stroke. No, it's like impossible.
Yeah.
What is made possible? I don't know. I never had that situation.
The gene from their parents.
Yeah, because of the gene that cannot be the risk. Because the risk that can be controlled is the genes. So it's 50-50. But if the kid like that, they do everything the kids cannot. The age, or the age is one. If 60 man drugs, smoke, or something,
He may be die, get stroke. something
yeah,
like
awesome. Easier. So let's go to the control. The thing we can control. Control is exercise. Physical exercise. You do exercise like you can do fiercely, like make your heart stronger. So you can pump more blood and healthy blood, get more oxygen when you run.
So doctor, did you exercise like mostly how many would be that you exercise? You know, you're like doctor working a lot in
Discipline of my times. You know, I'm the athletics. I play the best soccer in the high school when I was young. Okay.
I know your tricks.
Okay. No, I'm real. I'm that cool. I'm like a wow when I play the field. When I'm freshman, I use the senior only 1-0. That is the amazing. Nobody got it.
Good job.
And then it's have like the thing that control it. Let's go in the topic again.
Okay.
The thing that we can control is that, and like you need to go check up your blood pressure every time. You know, blood pressure is almost everything that causes this cardiovascular.
Like,
So you need to check the blood pressure.
like for real, people need to go like every month to the hospital to check for their body checkup.
And yes, of course, and eat good food, not high fat and saturated fat food.
Healthy one.
Healthy one that have less cholesterol, because cholesterol can break down and can be the disease.
Like most likely like the vegetables like that.
Vegetable is good and something that have protein, calcium. You need to eat all like the food to make sure you maintain good health. And what it is, I think it's helpful. It is. Thank you for asking.
So now we're gonna have some break. So now we are back to Healthcare Talk Show. And here we again with Dr. Gunnery. So now let's go in the topic about what is cancer, doctor?
Cancer is like a chronic disease and involves rapid and uncontrolled, like for the abnormal cells and spread for abnormal cells like that. So have any question about cancer?
Yeah, my grandfather also died with cancer.
Yeah, died with cancer. This is sad, but cancer is below the cancer cells or like a cancer tissue, we call it tumors, and the cancerous tumors we call it malignant tumors. And if not, it's called, if it's not cancerous, we call it benign tumors. And you know that when it's work at the tissue of the cancers surrounded the cell and then destroy it and replace it with the cancer cells and more. So when the form is developing, it's called metastasis. Yeah, metastasis. Metastasis is the first developing. And then cancer, yeah, if you know why your grandfather died and my dad died.
I don't know, can you please explain?
Of course, I need to learn about it because I don't do my mother do that. Of course, you need to find early detected so you know how to treat and control, and this can occur. But if it is too late, you just die.
So fine, doctor.
So sorry for that. Okay. okay now.
So, doctor, what is the cause of cancer? I know there's too many things that this come from our heredity, from our ancestor, and also from our environment.
Right. Maybe you get from your grandparents. Never mind. You don't get it, huh? Don't be serious. So you know the heredity? The cancer came from the chromosome of the heredity is called the opcode genes. And the thing that don't come from the heredity, come from the environment is called the carcinogens. Carcinogens. Carcinogens have a biological and chemical and physical. Chemical like smoke, you smoke get chemical inside your body. So that is chemical, and physical you get like an X-ray rays to your skin. As I said before, the growth.
Like industry, clouds, is those.
Yeah, like that. And the biological is like I think virus and bacteria, but mostly virus make you get cancer.
So, doctor, so how many types of cancer there are?
Okay, there are many types of cancer. You know cancers, the type of it depends on where it's occur. If you call the breast is breast cancer, if you call the skin is skin cancer. Or if you call the oral cancer is kidney, something like that. So what is your grandfather now for cancer? Sorry for telling that.
Okay, never mind, but for our scientific talk, my grandfather died from lung cancer. Yeah, on like when he was young, he smoked a lot.
Don't be like that. You know, lung cancer is very common for the smoker. That other smoke make your lung have a like you know the smoke have harmful chemical that make your lung person and you will be lung cancer and die. That's so sad. You know my father died from skin cancer. It's weird.
Oh no, look, the sunscreen.
Yes, sure. My father, he said that you want he won't do that or what. But sure, he don't think that you get cancer. Unexpected. He is champion, you know. And I get that gene from my father, so I'm also champion and everything. Now I'm the best of the learning and the physical from my father. So sad.
So sad to hear that. So first of all, doctor, how we can test to find this cancer in our body?
Yes, we need to use X-ray or screen test to find the cancer in our body, so that you know that cancer is before it goes into before it causes other bad result. So me or the doctor will search for your tissue and question and try to find out, and the procedure is called the biopsy.
But if I have one, can I go test with you?
Of course, now okay.
So doctor, if we find out when we have tests for the cancer, if we find out the cancer, so what treatment we should do to cure it?
It depends on the base of the cancer and type of the cancer, but sure we have one simple one as surgery. Of course, a surgery can remove like the malignant tumor, the cancerous tumor, so that you will be safe.
But if sometimes we remove it, but we still have, what we can do to it?
And radiation therapy is kill the cancer cells and slow the tumor's growth. And this also have chemotherapy. Use a drug to like a drug to like
Inject your body.
yeah, to slow down the growth of the tumors.
I heard that it's also kill the blood. Into the bad blood thing.
Okay,
By the cancer.
but don't be sure of this surgery. But some men surgery but still die because they don't take care of themselves. better thing is like don't eat the thing that may like cause the cancers. Here is a way how to prevent cancer. Okay, I think this is our last topic. But the first way to prevent cancer is to like tobacco. Avoiding tobacco. If you cannot avoid, just forget about it. Avoid it. Because this can cause you to die. Also alcohol.
We should prevent that.
Of course, and even the sunlight like my friend and then
And not tobacco, smoking.
if you cannot avoid, because of course you can avoid use a sunscreen or can or wear a long coat like you and me. Okay, and like eat a correct diet with a low cholesterol food. Not only cancer from low cholesterol food, but other chronic disease also important. Exercise important. And then avoid unnecessary X-rays. Some X-rays have some like a light that may cause you to be cancer or like a tumor to run or like this one. It's too far for you. And just check up
Every month. Yeah.
not sure maybe you also can, but if you feel not good, just go check up with. Of course, check up with me because I'm
The best.
of course.
So today our time is up, and thank you for Dr. Kanri to stay with us and tell about the cardiovascular disease and the cancer. Thank you, Dr. Kanri.
Thank you.
See you next week for our healthcare talk show. Welcome back again to Healthcare Talk Show for this week. I'm Norapat Devanish, your host for today. So today we're gonna talk about a topic about our chronic disease, and we have a very honored guest from the best hospital in Thailand, that is Sirilat. They come with very honored to see you guys and telling you about this topic for today, and he will give you lots of information. Please welcome him, Dr. Nathanai.
Hello, Mr. Norpat.
Hello, Dr. Nathanai.
I'm glad to meet you in the talk show.
Yeah. So how's your work?
Well, you know, it's always tiring consulting patients, treating them, prescribing medicine and stuff.
Yeah. Why Sirilat is the best hospital in Thailand?
Well, you know, in Silla there's a lot of skilled doctor like me. And of course, skilled doctor can treat patient goodly.
I know that you go and work to America and whole world. You work
Of
whole
course,
world.
I got a lot of, certificate from each school. Okay, so I heard you said that the topic is about other chronic disease, right?
Like diabetes. And
Yes, of course. Okay, so let's go with diabetes first. So, what is diabetes? Well, it's a disorder where the glucose in your body, and that is, good for you, but somehow the body can't use it. And usually that disorder involves the malfunctioning of insulin.
so doctor, what is insulin?
Well, insulin is a hormone produced from pancreas somewhere on the upper left of your stomach. It's like a maintainer for balancing the blood sugar level and maintaining. Because if it's too high, it's bad. Too low, it's also too bad. So it must be balanced. So now there are two types of diabetes.
Can you please help us explain the types of diabetes?
Okay, so let's go with the first one first. The name is type 1 diabetes. Very obvious. In type 1 is about like the body produce little or no insulin. And insulin, as I said, it's like a maintainer. So without maintainer to maintain the blood sugar in your the level, then it will either go low or go high, and which is not good. It mostly appear in any age, old, teen, young, whatever, but mostly appear in children first appear. And when you have it, type 1 diabetes, you have to check regularly with a doctor, and of course produce little or no. It means you have to inject the insulin into your body, which is, well, if you're scared of needle, good luck to you.
But I know that you're the best doctor. You can help the patient to be like.
Of course I can. I'm the best doctor. Okay, and then there's another one, type 2, right? Type 2 diabetes. So in type 2, it's a little different, but not so much. In type 2, your body produces the insulin, the hormones, very easily, normal, balanced. But it doesn't have the boss, which means that the body don't use the insulin correctly. It's like an employee without an employer, without a boss, so they don't know what to do, something like that. And well, when the symptoms of this, I forgot to say, are almost the same. Both type 1 and type 2 are almost the same. The symptoms are mostly including thirst, frequent urination, weight loss, and fragile. These are the common ones, very common ones. In type 1, right, you have to inject, but in type 2, you can control it either by exercising, maintain a healthy lifestyle. And of course, healthy lifestyle will improve every aspect in your body. So take good care of your body.
Oh yeah, doctor, can you help us distinguish between the type 1 and type 2 diabetes?
Well, in type 1, type 2, as I told you, it's a very little difference. In type 1, okay, in type 1, your body produces little or no insulin. But in type 2, they produce normally, but the body don't use it correctly. It's very little differences.
Okay, so let's go into allergies and asthma. Can you please help us explain?
Of course I can. An allergy is like some substance come into contact of your body, but somehow it's not a harmful substance, but your immune system thought it was a harmful one, and it overreact by either like scratches, itchy around the body. It's like very overreact, even though the substance are not harmful. If you have allergy to something, better avoid it. The substance that cause you allergy are called allergens. Each people have different allergy, like cat fur, dust, particles in the air, something like that. Each have difference.
So doctor, do you have any allergies?
No, not for now, no.
So you really take care of your body, well.
Yes, of course. I'm a doctor. I have to take care of myself so that I can take care of other people also.
Not those like doctors working a lot and doesn't.
I got my own technique. Okay, and if you have allergies, okay, tell your friends or anyone that can help you, because allergy can be very irritating. And mostly when there's an allergy attack, sorry, your body will release a chemical called histamine. It's a chemical where when you have allergy, the symptoms are mostly like watery eye and stuff like that, and of course irritating. And the way to prevent it, very easy. If you don't know what's your allergy, ask your parents, and if you know, avoid it. Definitely avoid it. There's a there's a medicine to relieve the allergy, but that's not good. Better avoid it.
So now, doctor, we have come to the third chronic disease, the arthritis. Can you help us explain this chronic disease?
Okay. In the arthritis is a chronic disease that affects the joint in your body anywhere, like leg, arms, shoulder, anywhere as long as it's a joint. And this it's like an inflammation or irritation of the joint. And when you have this chronic disorder, it's going to be very irritating to the point where it can change your normal lifestyle. It's like the symptoms are mostly joint stiffness, joint pain, and the swelling of the joint. Of course, it's very hurt also, very hurt. And the common one are mostly osteoarthritis. It's caused by it is a hard word. Arthritis is caused by wear and tear on joint after years of use by repeated injuries to a joint. Mostly occur in people that is old already, like 60-year-old, like my grandma. She will have this chronic disease. Symptoms include mild headache or soreness, usually on the hip, knees, and finger. And these are the very important part that can affect your lifestyle if something bad happened to you. Treatment are including drug, cold and hot treatment, and exercise. Exercise is very important for your life. Exercise keep you healthy, make your bones strong also. And the stronger the bone is, the better your joint is. Okay, next another joint chronic disorder, I would like to make it simple word, is the rheumatoid. It's a very hard word again. Arthritis. The membrane surrounding the joint, this membrane help the like your finger when you turn around like this. The membrane make it slide easily, or else your finger will be very rusty, just like a machine, rusty machine. Okay, and it's like it become inflamed, and when it become inflamed, it can affect another joint also. Like if it be in the thumb, it can affect to the rest four fingers, and which is a pretty very dangerous chronic disease. The cause of this chronic disease is unclear, not unknown, unclear. But most doctor and scientist researchers says that it's mostly caused by the immune system randomly attack the healthy tissue of your body. It's malfunctioning and it's just attack your body. It can be so served that it can deform your joint position. Like example, if it's a normal straight like this, it can make it by like just unimaginably deformed, become deformed. The treatment include aspirin or other anti-inflammation drugs, exercise and rest. Also, the early diagnose, discovering what the disease early stage is better than waiting for it to become too late, right? That in the late stage is mostly either your life changes or death, which is very bad.
So unfortunately, we had used up our time. But hey, Dr. Ranai, I want you to tell more, but our time is already used up.
Yeah, I also want to talk some more, but your time is used up.
Yeah, thank you for today, Ranai, Doctor.
Of course.
We'll meet you again for our next video. If you can come and interview us.
I'll be a pleasure to come here.
Yeah, thank you.
Okay, thank you. Hello ladies and gentlemen, welcome to this week healthcare talk show. My name is Nadanai, your new host. You may be wondering where's the original host. He's sick, so he take a day off. The show must go on, so I will be the replacement of him today. And today the topic is disabilities. We have a honored guest today that is going to explain us about disabilities in details. Please welcome Dr. Norapot.
Hello, Natanai.
Hello Dr. Norapot, how's your day?
I'm fine, thank you.
So if it's about disabilities, about children that can some disabilities, so it means you have to go outside the hospital and take care of them also?
Yeah, we go outside the hospital and take care of them, and we also come back to our hospital to study for their treatment to make their life better.
So what is disabilities?
Disabilities is a physical and mental limitation for their physical activities on their daily life.
And what are the main disabilities that we see these days?
On the main, we can see the vision disabilities, and also for the hearing and the mobilities.
So can you explain us these three?
Okay, I can explain for you. The impaired vision is mostly is eye. Vision is eye, So mostly people of the age of 40, they also have impaired vision. So like their eyes are farsighted, and also kids, they also have impaired vision. Also their genetics disorder from their parents. And the leading for these disabilities for this one, the vision one, we have diabetes and also cataract and glaucoma, and we also have macular degeneration. Macular degeneration is affecting the retina that can lead you to blind. The cataract is a cloudiness in your eye. The glaucoma is the pressure building up in your eyeball.
So is there any way, any technology in this world that can cure or treat this disability?
We also have technologies to help cure the impaired vision.
Can you give me one example?
Okay, one example is the cornea transplant that we have in our hospital also. It's restore the vision of some people only.
But is that a total cure or is it like not all?
Not all.
Not all.
Because of some of the vision impairment could not be treated.
Not yet enough technology.
Yeah.
So do you believe in the future there's gonna be a way to do it?
We believe because we study hard to study for the technologies. We're dealing with scientists to helping us making a machine that could help us.
Yeah, doctor, there's three disability, but you explained one already. How about the rest two?
Oh, the rest too. Yeah, first of all, I'm gonna train you about the impaired hearing. Impaired hearing is a hearing loss or deaf. Mostly occurred on older people. And sometimes it's also occurred on some younger kids, including infants. The main cause are usually birth defect, genetic disorder, and exposure to loud sound, or even ear infection, or the tinnitus.
Tinnitus? What's that?
Or tinnitus. Tinnitus is the conditioning where you can hear ringing sound in your ear. Even there is no sound around you.
And is there any way to treat this disability?
Treat these disabilities, yeah. It can be treated by hearing aids.
Hearing aids. What kind of technology is that?
Hearing aids is a small devices that put on your ear. Do you see some of the old men that they are wearing the small things?
Yeah.
Yeah, it helps increase the volume of sound to people with hearing, the deafness of hearing not completely.
Then is there some more?
Yeah, like when people are deaf, we need a sign language. Yeah, like
sign language.
your hands, they can see, they can still use your eyes, but they can't hear. So we need to use sign language and mouth, the reading of the mouth.
So I believe that someday we're gonna have a better hearing technologies, right? That can like completely restore the hearing.
Yeah, we are now studying on technologies, more technologies. We're gonna like go to the future world that we could help them
Completely cured.
completely hear them. We could have the new ear for them and put some electrical device on their ears.
So doctor, we finally reached the third and the last disability.
Yeah.
What is that disability?
The third disability is the impaired mobility. The body ability to move depends on the nervous system, the muscular system, and the skeletal system working together as one. If a disease or injury had occurred, the function may cause an impaired mobility. So the disease is such as the cerebral palsy and muscular dystrophy. Multiple sclerosis can develop in young children and may result in impaired mobility. In the elderly, arthritis, Alzheimer's disease, Parkinson's disease, and heart disease are common cause of impaired mobility. And the injury of impaired mobility is the paralysis of the arm or leg due to injuries to the brain or spinal cord. Is a major cause of impaired mobility. These kinds of injuries are frequently the result of unnecessary risk-taking, substance abuse, or are frequently the result of unnecessary violence. Nearly 80% of spinal cord injury victims are young males.
So is there any way to like make them move again, or at least movable?
Yeah, we can treat them like using canes, walker, wheelchair, crutches, or braces, or artificial limbs, or we can do some surgery with their muscles and their skeleton.
I think I heard you said about paralyzed. That means that people can't command their movement parts, right? So how are those cranes and wheelchair gonna work?
Oh, we doctors, yeah, and researchers are always searching for new technologies that can help these paralyzed people. So I believe that there's going to be some technique or technology in the future that we can help them.
Unfortunately, the time for our talk show is over. I really want a doctor to explain more about the disability, but no time anymore. I want to thank you again for coming to my talk show.
I'm so very thankful that you invited me to your show.
If I invite you again, will you come?
Yeah, come. So this is my first time Yeah, my first time. I doesn't go into public.
That's it for today, folks.